Good morning. On behalf of Child 360 and Early Edge California, I'd like to welcome you to our webinar, which is Early Learning and Care During COVID, Stories from the Field. My name is Bill Sperling, and I'm the CEO of Child 360. If you're unfamiliar with our organization, we are a nonprofit that supports nearly 600 early learning providers with coaching, professional development, assessment, and even now temporary staffing. We're very proud to be a supporting agency of ECE, especially during these difficult times. You know, throughout the COVID-19 pandemic, early care and education professionals have heroically cared for and educated thousands of California's children, enabling other essential workers to go to work and provide critical measures of security and stability to families across the state. But at the same time, many ECE providers have struggled to make ends meet as enrollments have decreased, and additional costs related to new health and safety standards have remained a constant burden. Many of California's early childhood professionals, the majority of whom are women of color, have put their health and the health of their families at risk on a daily basis. In the research and remarks you'll hear today from a study generously funded by First 5 LA, you'll learn more about the challenges that early educators have faced and also about best practices that have emerged, whether educators are providing in-person care or using technology to facilitate learning. You'll also hear about critical investments that are needed to support the childcare workforce, which has bolstered all other industries as our economy reopens. Now, to kick us off today, we're going to be hearing from California State Senator Connie Leyva, who's been a tremendous early learning champion and who represents the residents of Senate District 20. After that, we'll hear highlights from our new policy report provided by Child 360's Director of Public Policy, Elsa Jacobson, and Early Edge California's Director of Dual Language Learner Programs, Caroline Collat. Following their presentation, we'll hear remarks from Rachel Cordova, a child care provider who directs McKinley Montessori Academy in Pomona, California. Then we'll provide a series of policy and program recommendations, and following a short Q&A, we'll hear from Early Edge California CEO, Patricia Lozano. We encourage you to stay with us for the entire webinar, and please feel free to include your questions at the Q&A section. We may not be able to address all the questions, but we will do our best to respond to you individually following the webinar if we don't get to you. And with that, I'd like to welcome and turn over the proceedings to Senator Leyva.
Good morning. Thank you, Bill, for that nice introduction. I'm so happy to be here with all of you, even if it is just virtually. I'm looking forward to the days when we'll all get to see each other again in person, but until then, we all know how to use Zoom, and I think it's working just fine. As the previous chair of the Legislative Women's Caucus, I am incredibly proud of the work that we have accomplished as a caucus. For over 20 years, the Legislative Women's Caucus has fought for increased access to subsidized child care. In fact, in the last 10 years, the sole budget ask of the Women's Caucus has been related to childcare, whether it is an increase in provider rates, an increase in slots, or an increase in workforce development of these ECE professionals. As the entire state came to a halt last year, child care providers were severely, as you well know, impacted. While many were forced to close, others remained open to serve families and other essential workers, and we thank them. This pandemic has brought new challenges to the ECE world. ECE essential workers were now serving other essential workers, risking exposure to the virus and potentially bringing it home to their loved ones. It was clear that we as a legislature needed to act. At the time, I was the chair of the Legislative Women's Caucus, and I requested an early meeting with the governor. We wanted to make sure that we were partners in working to resolve these issues. From there, we created a child care working group with the administration. We discussed the needs of the industry, immediate access, new funds to provide adequate PPE, more slots to essential workers, pop-up providers, hold harmless provisions for providers, dual enrollment coverage, and family fee waivers for families. Our budget request was also shifted. While child care was always going to be a priority, we were now discussing ways of investing to keep child care providers open, an incentive for closed child care providers to reopen. Sadly, the governor's May revise proposed a 10% cut to provider rates that would have been absolutely devastating. We fought hard to maintain the current rates since we knew that providers could not afford such a hit. Actually, we fought hard, but we really just said, no, we're not going to accept that. Sometimes you can't negotiate. And so that's what we decided to do. Just said no. 246, rate reform. While I am no longer the chair of the Women's Caucus, this year I have reintroduced child care stabilization.
Well, it looks like the senator has frozen for a minute. Maybe we'll give it about 30 more seconds and hope she's able to rejoin us. There she is.
I don't know what happened. Sorry about that. I'm like, oh, I went away, but I'm back. We have to be flexible during these times, right? So SB 246, which I think is what I was talking about, will establish a single a regionalized reimbursement rate system for childcare, preschool, and early learning services. The current bifurcated rate is inadequate for reimbursement rates. It complicates efforts to fund and deliver high quality early care and education programs that meet the developmental needs of all children. This unaligned two-system approach limits access, fails to maximize program quality, and is forcing many child care providers out of business here in California. Now, more than ever, it is time to restructure how we reimburse providers. We must start by raising provider rates equitably across the board, no matter what type of provider and location that provider is in. After all, without a child care, we will not have an economic recovery, especially for women. Through these reforms, California can achieve a more equitable system to support children and families and maximize public benefit. So before I end my remarks today, I just want to thank you for all the work you do, how amazing you have been during this really, really hard time. We have lots of work to do. Know that myself and Team Leva stands ready to help you. We support you and we appreciate you. Thank you for having me today.
Thank you so much, Senator Leva, one of the most important champions for early childhood in the legislature. We really appreciate your work, and particularly on SB 246, which I can say Child 360 is supporting and is very much in line with some of the research that we're going to hear about today. And we just really appreciate your shining a light on the heroic and really valiant efforts of ECE professionals and spearheading this work in the legislature. So
happy to do it.
Without further ado, I'll move on. My name is Elsa Jacobson, and I'm the Director of Public Policy at Child 360. And Child 360 and Early Edge California were very interested in learning more about the COVID-related challenges of ECE professionals, as well as about some of the in-person distance learning and family engagement strategies that are working well despite very difficult circumstances. We conducted research on these issues, and we'd like to share some of the highlights of the research with you today. So if we could go ahead and share the PowerPoint, it would be much appreciated. All right, and we could go on to the next slide. Perfect. So we developed an online survey that was administered to individuals working in ECE programs throughout LA County for whom Child 360 and the Child Care Alliance of Los Angeles are providing quality improvement services. As you can see, nearly 600 ECE professionals completed the survey in late fall, and this included both providers and teachers. Over 85% of respondents were people of color, and approximately 3/4 of respondents worked at a center and about 1/4 worked at a family child care home. And next slide, please. Nearly half of respondents provided both in-person care and distance learning, while nearly 27% provided only distance learning and nearly 27% provided only in-person care. The vast majority of respondents served preschoolers, just over half served toddlers, over 30% served infants, and 30% served school-age children. Many respondents also served multiple age groups, and 22% worked at sites that served all 4 age groups. Next slide, please. Most providers funded their programs through multiple sources. 45% received California State Preschool Program funding and 43% received parent fees. And you can see the other sources of funding listed on the slide. In addition, 67% of providers reported serving children of essential workers. Of course, in a critical service, particularly during the pandemic. And that statistic was out of the nearly 300 providers who responded to that question. After the online survey was completed, we also held 2 small focus groups, one with 8 providers and another with 7 lead teachers, in order to further explore key issues addressed in the online survey. Next slide, please. As Senator Leyva alluded to, we know that the COVID-19 pandemic has had a devastating financial impact on the early care and education sector. As you'll see from the data below, many ECE providers experienced drops in enrollment and incurred costs related to meeting new health and safety guidelines. When we asked ECE providers about the challenges their programs were facing, low enrollment was the most frequently cited challenge. And of the 380 providers who answered a question about whether they were operating at or below capacity, nearly 72% reported that they were operating below capacity, and 64% of these providers were centers. Lower enrollment has meant less income for providers who operated on razor-thin margins even before the pandemic. Consequently, it wasn't surprising that of the 308 providers who answered a question about their revenue, nearly 51% reported that there was a gap between their monthly costs and their revenue or reimbursement. We also asked ECE providers about the costs they were most worried about being able to cover, and they most frequently cited cleaning supplies and PPE, personnel, and facilities costs. With regard to facilities costs, providers have needed to do things like purchase portable sinks or no-touch faucets to help with hand washing. They've needed to convert spaces into classrooms, whether indoor or outdoor, in order to maintain social distancing. And these are just a few examples of the facilities costs that many providers have incurred. In addition, it's noteworthy that rent and mortgage costs were cited as a top challenge by family childcare providers. Ultimately, due to financial pressures, health concerns, and other issues, we know that over 4,000 licensed childcare facilities permanently closed in California from March 2020 to February 2021. That is a sobering number. And thousands more closed temporarily and continue to struggle to cover their costs. Next slide, please. We also surveyed respondents about challenges they had that were specific to providing in-person care. And the most frequently cited challenge was ensuring that children are socially distanced during play and instruction. I know that many of the parents out there can relate to this. As one provider explained, quote, "Kids attract and they want to play with each other, and they were not understanding why we had to separate them when we always told them work together, play together. And now we're like, nope. No, we're not doing that anymore. You have to be away from each other." In addition, the concern most frequently identified by respondents for the children in their programs was that children do not have enough social interaction with their peers. And our focus group participants explained that physical distancing can limit the social interactions that help children develop critical socio-emotional and language skills. Next slide, please. Respondents providing in-person care also identified strategies that worked well for them during the pandemic. We wanted to highlight those bright spots. And the most frequently cited strategies were providing each child with his or her own set of toys, keeping children in small groups with the same teacher and children, and providing more outdoor activities or increased time outdoors. Next slide, please. We also surveyed respondents about challenges they had that were specific to providing distance learning. And the most frequently cited challenges were having children tune in to distance learning lessons, keeping children engaged and/or dealing with interruptions during the lesson or activities, and creating engaging distance learning lessons and activities. In addition, both survey respondents and focus group participants highlighted struggles families were facing that made it challenging for them to consistently tune in for or even to access distance learning. And these challenges can be seen on the next slide. ECE professionals indicated that one of the significant unmet needs for families was someone to support their children's home learning while they work. And the reason for this, as some focus group participants explained, was that in some cases where parents were working, the individual caring for their children lacked knowledge of how to support the distance learning process. Other significant unmet needs were technological devices and a reliable internet connection. These three issues lay bare the stark digital divide that has prevented some children from equitably accessing instruction and educational support, both before and during the pandemic. Next slide. Respondents who were offering distance learning also identified strategies that had worked well for their programs. And the most frequently cited strategies were providing families with art supplies or other materials that they can use for home learning activities, particularly in cases where families didn't have a strong internet connection or perhaps lacked a device. Providing parents with instructions on how to do those activities with their children at home was also very important, and respondents indicated that it was critical to provide these instructions in the family's home language. Playing games and facilitating activities that involve movement with children was also cited as a good strategy. Next slide, please. Our focus group participants emphasized the importance of assisting parents with technology, whether that meant Zoom tutorials, in-person technical support, etc. Providing pre-recorded videos or digital activities that children could watch or do on their own time was also an important strategy that was used. Reserving a designated amount of time for open conversations, particularly to help children process and verbalize the challenges and trauma that they have experienced as a result of COVID-19, was also suggested by focus group participants. They also talked about the importance of being flexible about children's participation in distance learning and their families' ability to support them. Next slide. Whether ECE professionals are serving children under emergency conditions or teaching under more traditional circumstances, they need professional development support to help them continually hone their craft and respond to new challenges, conditions, and child needs. We asked respondents what professional development trainings they were most interested in receiving during the pandemic. We provided them with a list of potential topics, and then they were asked to rank them in order of interest. And what you see on the slide is not the full list of topics. But overall, the topic that received the highest ranking was working with children with challenging behaviors, followed by distance learning methods and helping children develop social skills. And even when the survey results were broken down by the type of instruction respondents were providing, as you can see on the slide, the results were still very similar. On the topic of challenging behaviors, the Center for the Developing Child at Harvard University explains, quote, that problematic behaviors may need to be treated as a result of the ACEs or other traumatic experiences someone has had. And this really speaks to the need for trauma-informed care, particularly given the incredible stresses and challenges that children and families have faced during the pandemic. Next slide. Respondents were also asked to indicate whether their interactions with the parents and caregivers in their program were more or less frequent than they had been prior to COVID-19. Interestingly, the majority of respondents offering distance learning or a hybrid model reported more frequent interactions with parents than they'd had prior to the pandemic. In contrast, just over half of respondents providing in-person care reported less frequent interactions. Next slide. For respondents providing distance learning, common reasons given to explain more frequent interactions were that parents participated in and supported their children during virtual classes and activities, and ECE professionals were in constant communication with families about daily activities and other issues. Next slide, please. However, common reasons given to explain less frequent interactions were that some parents didn't tune into distance learning lessons or didn't respond or took a while to respond to texts and emails. Survey respondents attributed this to parents' lack of access to or facility with technology, busy work schedules, and or the need to tend to other children. As one teacher wrote, quote, interactions are less frequent because parents seem to be stressed out and have less time due to having other children log into Zoom. Many parents work and don't have time to do online Zoom classes or interact with teachers. Next slide. For respondents providing in-person care, common reasons given to explain more frequent interactions were that parents had more questions, particularly about their children's health and safety. And ECE professionals were communicating with parents frequently about their health and about health policies. However, common reasons given to explain less frequent interactions were that parents couldn't come into the classroom or enter the site. And of course, time spent speaking with parents during drop-off and pickup was more brief than it had been prior to COVID-19. Ultimately, the frequency of parent interactions really varied from program to program. Now I'd like to turn the time over to my colleague, Carolyn Kralot from Early Edge, California, to discuss several other research highlights. So Carolyn, please take it away.
Thank you, Elsa. Survey respondents were also asked, actually it's the next slide. Yes. Survey respondents were also asked what methods of communication they found were most effective in reaching parents during COVID-19, and communicating with parents by phone was most frequently cited as an effective method of communication, followed by text and email. In addition, focus group participants offered suggestions for fostering more effective family engagement, such as offering parents individual Zoom meetings, calling parents with positive news or feedback about their child's progress, and responding promptly to parent questions and concerns and letting them know staff are there to support them. And across the board, ECE professionals reported making efforts to communicate frequently with families. Next slide, please. Now we're going to talk a little bit about our findings related to supporting dual language learners. In California, nearly 60% of children birthed to age 5 live in a home where a language other than English is spoken, and these children are known as dual language learners. 84% of survey respondents reported serving children who are dual language learners, and 61% indicated that they serve children in a dual language program, which is one where children are taught literacy and content in both English and another language. And of the respondents who serve children in dual language programs, 94.4% reported that a non-English language of instruction was Spanish. Next slide, please. Survey respondents were asked what challenges, if any, they had experienced in engaging with families from diverse linguistic backgrounds. And the challenge most frequently cited by respondents was that families struggled with technology to support their children's distance learning. And the second most frequently cited challenge was that families struggled to help their children with activities assigned by the teacher, which could be due to language barriers experienced by the family and lack of linguistic supports. Next slide, please. Respondents were also asked what strategies were most effective in engaging families from diverse linguistic backgrounds. The strategy that was most frequently cited as effective was having a bilingual staff member communicating in the family's primary language, followed by connecting and engaging daily with parents, either by phone, email, or text. And the third most frequently cited strategy was translating communications into families' primary language. Multiple focus group participants confirmed the benefit of having bilingual staff members who can communicate in the family's home language, as is demonstrated in the quote we provided here from one of our providers. And now we'd like to turn the time over to Rachel Cordova, the program director at McKinley Montessori Academy, to share her experience running an early learning program during COVID-19.
Good morning. My name is Rachel Cordova, and I'm the program director at McKinley Montessori Academy in Pomona, California. I'm grateful to speak on behalf of my program and other early childhood education providers about the experience of operating an early childhood program during the pandemic. Here at McKinley Montessori, we serve children from 3 months to 5 years old. Most of our families are considered low-income families. We have about 95 eligible families for free services due to their income, and 70 of our families are essential workers. Despite difficult circumstances, we have continued to provide in-person services throughout the pandemic to meet our families' needs. After the pandemic began, our program enrollment dropped significantly from 75 children in January 2020 to 47 children in April 2021. And enrollment has increased, but we have to be careful about how many more children we can add to our school due to the Centers for Disease Control guidelines of 2 staff for every 14 children to maintain cohorts of 16 people in a room. We also changed many aspects of our practice to follow new guidelines and keep everyone safe. For example, we used to have circle time 3 days a day for 10 minutes each session. Now, due to the safety guidelines, we are not supposed to do circle time indoors, and singing is not allowed. So instead, we talk about the child's day and their feelings, and we say the letter sounds and count numbers. We used to do family-style meals, but now we must serve the food on disposable plates, which are thrown away after the meal. We used to ask children to share materials, but now we are not supposed to share any toys or other resources. And each time a child uses a toy, we have to sanitize it. The writing materials are now separated into pencil boxes, including pencils, crayons, markers, scissors, glue sticks, etc. Each child must have their own set of toys and writing materials. We work long hours a week, approximately 9 to 10 hours per day, providing quality care and education for our students. We have to clean more and sanitize everything before we leave our premises. However, we are also need to attend many telebriefings from the health department to stay with the updated guidelines. And we also have to attend the California Department of Education webinars and maintain weekly communication with our community care licensing program analysts to ensure we follow all the safety and health measures that they want for everyone to be safe. Although we follow safety and sanitation regulations, some of our parents are scared to bring children to school due to concerns about COVID-19. We reassure parents by giving them a list of the safety and sanitation guidelines we've implemented to keep the environment clean and maintain everyone safe and healthy. We added cleaning and sanitation practices to high traffic areas like doorknobs and where they flush the toilets as well. Some of the families in our program qualify for the California State Preschool Program subsidized, but we also have private fee families who do not qualify for those funds. So we try to help them as well. When the pandemic hit and some private fee families decided to keep their families home, we were very grateful for the hold harmless provision that enabled us to earn the entire state preschool program contract, because this prevented us from laying off our teachers. We had to close our program for 2 weeks from December 28 until January 11 due to positive COVID cases arising in our community. We decided to close as a preventive measure due to the surges. It was a very difficult decision because we serve essential workers, but we wanted to prevent exposures in our program. We also asked our janitors to continue with the sanitation of the classrooms, including the high traffic areas. We were worried about the health and safety of children and our staff, but we made it through that. We contacted also our payroll department, and they advised us to use the 10 paid days given to all employees to cover the exposure for COVID-19. Ultimately, we were grateful to pay our staff for the 2 weeks still we closed the school. One bright side of the pandemic has been that our teachers could attend online workshops and obtain many hours of professional development. The workshops included social and emotional strategies for teachers to use with children, implemented lessons plans, activities about emotions, and the importance for teachers to have self-care. Teachers do need to take care of themselves as well. Since we also needed to maintain small cohorts in the classroom, this promoted more one-to-one education, and children gained more close attention and instruction from their teachers. One of our concerns is to continue to provide cleaning and sanitation guidelines. We need to continue to receive funding for cleaning and sanitation materials. Even after the pandemic, we're still going to have to do cleaning more now than ever. We need also personal protective equipment, including hand sanitizers, sanitizing wipes, face masks for adults and children, thermometers, and other materials. We also are concerned about the state-funded program to continue to keep our teachers' salaries for the upcoming year. In addition, state and federal funding if additional state and federal funding was available, first, I would recommend that it would be used to increase staff salaries, at least $2 above the minimum wage. We know the value of our teachers and the critical impact they make in the children's lives. But they are underpaid, and this drives the high turnover rate in our early childcare field. I would also recommend that additional funding increase facility improvements like outdoor structures, indoor flooring, new paint jobs, and playground enhancements as well. As early child education providers, we are resilient and incredibly hardworking, but we need support to stabilize our programs, and we need to be paid a better wage that recognizes our essential work. We need to be recognized as essential workers and professionals. Throughout the pandemic, I was working on my master's degree in education, and now in May 2021, I will be graduating. We provide foundational skills for children to go to elementary. I'm grateful to speak on behalf of other educators. I'm glad my voice was heard, but many ECE professionals are working many hours and cannot always attend the webinars like this. Elected officials need to fight for these individuals. For all professionals, thank you.
Thank you so much, Rachel. We are so appreciative that you took the time to be with us and raising your voice about these important issues, and also speaking on behalf of many other providers. I know we had a conversation before the webinar, and you told me that you've been in touch with many other providers, and that some of the things that you shared today were very much reflective of what's going on in the field. So thank you so much for taking the time and for your service. Taking into consideration some of the research highlights that we've shared today, as well as Rachel's remarks and Senator Leva's remarks, we'd like to share with you just a few brief recommendations that will inform future ECE investments, as well as future ECE practices. So if we could please go to the PowerPoint presentation, it'd be much appreciated. Perfect. So what we're recommending first is direct funding for the ECE field in the form of flexible stipends to ECE providers to cover cleaning costs and PPE, personnel, and other costs necessary for reopening, remaining open, and safely serving families. And Rachel alluded to the fact that cleaning and sanitation practices are ongoing, and so this is a financial need that will continue. We also strongly recommend increasing reimbursement rates for state-subsidized childcare and development programs to ensure that early educators are fairly compensated and to address chronic issues of high teacher turnover and stress within the profession. When determining funding allocations for provider stipends or other supports, it will also be critical to ensure an equitable distribution of funding that prioritizes high-need communities and recognizes the economic insecurity, racial injustice, and COVID-19 impacts that these communities have experienced. Technology will continue to be used by some early learning programs, so we recommend surveying a wide array of early educators to identify effective ways to help parents and caregivers utilize technology and remote learning platforms, and then share best practices with the ECE field. I think particularly when digital learning is part of ECE programs curriculum, it's also going to be important to work with public agencies, elected officials, and philanthropic partners to ensure that families have a stable internet connection as well as a device for each child. It's also going to be important to consistently check in with parents or other caregivers to determine their technology-related needs, and then to assess which digital home learning activities are feasible and effective. And so many ECE providers have already done a very good job of that. Next slide, please. Oh, if we could have the next slide. Perfect. We also recommend serving a wide array of early educators to identify effective ways to foster social emotional learning, whether that be through technology or in an in-person setting, and then to share best practices with the ECE field. And some of the best practices can be found in our policy report, which we hope that you'll all read. We also recommend expanding access to professional development trainings and higher education coursework on topics that will help educators support all children in their care, including the trainings that you see listed on the slide. And next slide, please. I'm going to turn time over to my colleague, Carolyn.
Thank you, Elsa. ECE professionals have been communicating frequently with families during the pandemic to provide program updates, build relationships, assess child and family needs, share information about children's development, and to partner on learning activities. And these are best practices that should continue. And utilizing communication strategies that work well for both parents and educators is also essential. We also recommend that education leaders and elected officials join early educators in highlighting the safety of ECE program environments when health and safety protocols are in place to help encourage parents to return their children to in-person care. ECE providers not only provide children with care and instruction, but often serve as trusted messengers in their communities. Particularly during the pandemic, some providers are connecting families to an array of supports, including health, mental health, dental services, food, and other resources. And while these efforts are vital to families, ECE professionals do not receive compensation for serving as community liaisons. The state should make efforts to better coordinate the array of services and supports that are available to working families and to inform families of how to access these resources. The creation of community navigators who could help parents determine the supports for which they qualify and how to access them would also be a worthy investment. We also recommend developing and implementing strategies to recruit more bilingual candidates into the ECE workforce to support DLL's home language development, as well as family communication and connections. In addition, we recommend offering more professional development trainings and higher education coursework on supporting DLLs and engaging with culturally and linguistically diverse families. Teacher preparation and ongoing professional development with an explicit emphasis on serving DLLs is crucial to promoting these children's academic success. And finally, we recommend increasing funding for books and materials in children's home languages. Providing these resources is important for DLL children's socio-emotional and positive identity development. And in addition, the availability of books in children's home language supports their literacy development in both their home language and in English. And we also wanted to note that our DLL specific recommendations are aligned with the Master Plan for Early Learning and Care, which was released in December 2020. Thank you.
Thank you so much, Carolyn. So we've both been monitoring the Q&A during the presentation, and it didn't look like there were many questions that came in. One question that did come in was whether or not this whole presentation is being recorded, and it has been. And so all of you who registered for the webinar will be receiving a copy of the webinar recording as well as our policy report that, again, we hope that you'll read. And if you have any other questions about the report, we will also include in the email our email addresses so that you can reach out with any questions. And with that, I'll turn the time over to Carolyn.
Great. Just wanted to say thank you so much for joining us today. We're really excited to share these important findings with you, and we hope you'll take the time to read our report in depth. And now I just wanted to turn it over to Patricia Lozano, Executive Director for Early Edge, to share some closing remarks.
Thank you, Carolyn. Good afternoon, and thank you all for joining today. You know, the Biden-Harris administration has already acknowledged that childcare and early learning are critical with the American Jobs Plan, and Congress has signaled its support for the industry with nearly $40 billion in childcare relief that was included in the American Rescue Plan Act. Early Edge and Child 360 look forward to working with elected officials at all levels of government and with our ECE partners to ensure that early educators are well supported in their work and recognized for their essential service. The data also evidence the need to provide training for the workforce on how to support dual language learners as programs reopen now and in the future. We would like to thank the hundreds of early educators who contributed to this project. For Early Edge and Child 360, it is critical that we're uplifting the voices of those taking care of and educating our children and ensuring that we are connecting policy and practice. We would also like to give a special thank you to Child 360 and Early Edge Communications and IT teams, to Child 360 Senior Research Analyst, Mariel Dorfel, and to the multiple ECE partners who support this project. Finally, we would like to thank our funder, First 5LA, for supporting our research and for making this report possible. And I know there are a few questions coming in the chat, so I don't know, Elsa, if you want to address those.
Let's see. Yes, there are a couple that came in just at the very end.
Mhm.
And a number of the questions that came in relate to whether or not there will be funding available to providers who have struggled with their costs during the pandemic. And, that's part of what the senator was speaking about in her remarks. There have been some relief efforts already made by the state legislature, and what they're going to be considering in the next couple of months, in part, is how to spend some of the new federal dollars that have already been designated for childcare relief. So certainly help is on the way, and part of our job as advocates is to listen to you so that we can help legislators know how to direct that funding, what the funding should be used for, whether for flexible stipends or emergency childcare vouchers, et cetera. But those budget negotiations will be taking place, and we encourage you to lean in and let legislators know what you need. Certainly there is funding available, particularly from the federal government. So I think that we'll stop there. We're a little over time. And again, please feel free to reach out to us for any additional questions, and you all will be receiving a copy of the recorded webinar and the policy report. So thank you all, and have a terrific afternoon.